Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening. Welcome to another edition of Health Matters. And as always, we focus and try to focus on what's happening for the current month. It is September. Alhamdulillah, beautiful spring. The lovely city of Johannesburg, wherever you find yourself within South Africa or abroad, we welcome you to another edition. So remember, if you've missed any of our Health Matters shows, you can catch it on ITV Network's YouTube channel. There's over 100 of shows of Health Matters, informative medical shows. We also thank the team of IMA helping us put together productions of the show. So today we focus on childhood cancer, which is the current awareness month. We have in studio Professor Michael Harps, if I said that correctly. But thank you so much for your time, sir, and welcome to Health Matters.
Thank you very much for having me.
So it's a pleasure discussing childhood cancer because there's quite some niggly, interesting questions to get out that we need to tell the viewers about today, and that we will hopefully unpack.
Absolutely. It's so important that we specialize tonight and during today on childhood cancers because it can be so different to what we see in adults.
And apparently some of it's not even diagnosed. So let's unpack exactly what childhood cancer awareness is all about for our viewers.
I think it's important that maybe for the viewers we tell them what cancer is, because there's always or often a misconception about what cancer is. Cancer is the abnormal multiplication and growth of cells. So they just keep on multiplying in an uncontrolled manner, and they just become more and more and more, and that is why it also very often causes a lump or a tumor that we call it.
Oh, yeah, a growth of some sort.
But there are also non-carcinogenic lumps or tumors that are not cancerous. But what makes cancer so unique is that cancer has the ability to also penetrate other tissue. So it doesn't stay in its own tumor, it infiltrates and goes towards and into other tissue. Then, apart from that, it can also spread to totally other distant parts in the body. And that is what makes cancer so unique.
So it's interesting that you've made it so simple for us. Tell us what you do for cancer.
Well, I am part of the research department, and one of my main responsibilities is to write information brochures. And I have produced for the organization over 300 fact sheets on every conceivable cancer. Some of the very rare and most rare cancers I've already produced fact sheets. So anybody who wants info can go to the cancer website, and all the fact sheets are there.
So we are sitting with literally a dictionary of cancer in studio with us today. We'd really like to unpack and delve into that type of cancers, but we've got to focus today.
Focus on childhood.
Okay, so the awareness around Childhood Month, what do we need to know?
Well, it is so important, I said earlier on that cancer in children is uniquely different from what we see in adults. In adults as well, we know that the environment and lifestyle especially plays an absolutely major part. For instance, obesity. We don't eat correctly, so we become obese, and we know that obesity is a leading cause for certain cancers. Or smoking, alcohol use, and that type of thing that we find in the general population. Now, this does not exist with children because they're tiny. Because children, sometimes a few months old, may be diagnosed with one or other form of childhood cancer. And so these lifestyle things do not really play that much of a role. Also, only about 10% of childhood cancers, there is a genetic predisposition.
10%.
So that leaves us a major section of childhood cancers which we don't know the cause. And here we can only surmise that it must be the environment. Air pollution, contaminated something that we put onto the body or into the body, or chemicals that the body is exposed to. So those are the important things.
Outside influence.
Yes.
So what would we say, according to the Cancer Association of South Africa, currently between 800 to 1,000 children are diagnosed with cancer annually. However, it is estimated that half of that children with the cancer in South Africa actually never go diagnosed. They actually don't pick it up. How is that so?
That is so. Well, it all depends on whose statistics you look at.
Okay.
Because there are statistics for South Africa that says up to 2/3 of children are never diagnosed. And it has part to do with our health system. Our health system isn't very accessible to most people, and we think here of people living in rural and far rural areas. They are dependent totally on a distant primary healthcare clinic with staff that are not necessarily well trained and well qualified to see the more subtle things we come across in some of those clinics when we go out with our mobile clinic.
Okay.
That a mother would be there with fulminating breast cancer. She's given Panados and sent home.
My goodness.
So imagine a child, and especially when we start talking about the signs and symptoms of childhood cancers, you will see what happens to children very quickly. Because what we're looking at, as far as signs and symptoms in children are concerned, we're looking at the whole array of childhood diseases. We're looking at painful joints and legs that don't feel strong as they should be. And especially if that appears in teenagers, we say, oh, it's growing pains.
Okay.
We've got a child who vomits. We say, oh, you know, he's eaten something that he shouldn't have. Or we have flu-like symptoms. Oh, it's going to pass one of these days. He's just a little bit feverish. Nighttime sweating. Most children's diseases give you nighttime sweating. So the signs and symptoms that we see in children are so ubiquitous, they're so common with ordinary childhood conditions that we very often miss out on really getting a child diagnosed. And then we must remember that about 50% of all childhood cancers occur in children under the age of 4 to 6 years.
50%.
About 50% of all cancers are diagnosed in that age group. But, you know,
And that's the time that it could possibly be missed as well.
And it's so easy to misdiagnose. And
so are we saying because of the common symptoms of childhood, other childhood illnesses, that is the reason why it's being missed?
It's one of the reasons why it's missed. But here comes the wonderful message. A mother, they usually are spot on. And I want to say to mothers tonight, if you see any childhood symptoms, that we've mentioned some of them, and you've got this little feeling, something whispering in your ear, something in your heart, something talking in your mind.
That sixth sense.
Believe it, yes, absolutely. And be firm and take the child to the doctor. I'm not saying to parents, run to the doctor for every little sign or symptom that you see in your child. But you as a mother will know that this is something, it keeps on coming back. It's recurring. It doesn't go away. It's lasting now for a week, 10 days. Don't let it go on any further than that. Take the child to the doctor. And remember, you have a right to a second opinion.
Absolutely. We talk about mom's sixth sense and how she can take things a little bit further. When you're not exactly happy with the results of your current doctor, we know we're not talking about being frantic or, overstressed. We are talking about real conditions that exist. And until you get your final good answer you're happy with, your sixth sense can then rest and lie calm. But we talk more on Childhood Awareness Month, Childhood Cancer Awareness Month, more just after this. Assalamu alaikum and welcome back. A very good evening. This is Health Matters and we're chatting about Childhood Cancer Awareness Month, which is happening now throughout the month of September. We know every month there's a focus and probably every week. Last month we missed out a bit on the cancer care. So please do note that if you've got any questions, comments, questions around cancer and their care. They have a long list of hospices around South Africa, and we do have a representative for cancer in studio with us, so he'll guide us a little bit about that. But today, like I said, the Dictionary of Cancer is in studio with us. This gentleman is part of the research team, and he puts together fact sheets of over 300 different cases of fact sheets that is available from cancer. So thank you so much for your time, Professor Michael. So looking at that feeling that mom gets when she goes to the doctor, because we are kind of focusing, as you mentioned, 2/3 of childhood cancers go undiagnosed and unnoticed because of various reasons. And we've mentioned the symptoms, the common symptoms that comes from childhood, just basic childhood illnesses. You've mentioned the joint pains, the fever, and those are all the things that are presented when it comes to cancer, right?
Yes.
So if the mother, as you said, the mother feels that, listen, this is going on for a little bit too long, what are the sort of conclusive tests and results that she can go for, and second opinions, not necessarily she could go to a GP, but other specialists as well that she can find, results?
Yes, usually a mother will go, under the current system, will go to her GP.
Okay.
And mothers are very good at record and remembering things. And this is so crucial because if you can keep in mind and go to the doctor and say, the child started off with this 3 days ago, or is now already on the 5th day and whatever, and give a description of the changes that you've seen and observed in your child.
Okay.
So you've got to know your child, so that if something is different today than it was last week, you will be able to recognize it. Unexplained bruises.
You mentioned records. Do you have to keep track of the dates and the times and
more or less, because you want to emphasize to the doctor that this is not something that started this morning.
Okay.
It's now ongoing for 5 or 6 or 10 days.
Okay.
And mothers usually remember this type of thing, because every morning they get up and they see the child and say, it's now the 2nd day and it's still like that. Well, let's hope tomorrow is going to be better. And mothers, remember, they are unique beings. That's why we are given mothers, so that they can take care of us adequately.
Absolutely.
So
would
unexplained bruises.
Would you say that the child gets better? The child doesn't get better?
Well, sometimes it does seem like the child's getting better, but it recurs. So it goes well for a day, and then the same symptoms come back again. And it lasts for a few days. Then it becomes really, it should make us concerned. And these, as I said, could be unexplained bruises. It could be especially vomiting early in the morning. The child all of a sudden has got a limp. Balance isn't what it should be. There's a lump where the child never had a lump, especially in the neck, in the chest, under the armpits, the abdomen, the groins. Those are very diagnostic areas if there are lumps there, because that is very often some of the lymph nodes that are becoming infected because of whatever problem there is, and we can feel and they can be quite big, some of these lumps.
So if you see some of the danger signs and you're worried and your GP, your doctor's not quite advising you, they've given you some painkillers, but you decide, okay, you know what, and sometimes off the cuff you're thinking as a mother, this painkiller is not working, I'm going to give this child something a little bit stronger, like a Disprin or a Brufen or Miprodol. What is your advice to going the extra mile when doctors haven't necessarily advised you on that?
Before going that extra mile and changing the treatment of your child, ask for a second opinion. Go to another doctor and have the child seen to, and explain to him and say, look, I've had the child with another doctor, but I don't feel comfortable because there's no progress in us reaching a conclusion. And are there any possible tests that can be done? to assist us in getting to a diagnosis.
Let's talk about the facilities that's available to mothers and children. We know Red Cross Hospital is based in Cape Town, one of, if not the best children's hospital in Africa. Talk to us about other hospitals where people are, or clinics, in fact, that they go out to when the child is not better after 3 or 10 days, and they don't have that facility of a specialist and going to a GP to say, listen, my child is just not getting better. What else is there for them?
There's very little for them. The child, and this is one of the major causes of the large percentage of children who are not diagnosed. So they're sent home with a few tablets for fever or for pain or for discomfort. And there are also so many myths around the various cancers that people don't want to disclose that they may have a cancer as well. We find it even in adults, and this adds to the whole problem. And really, my heart goes out to people in rural and far rural areas.
Absolutely.
And we can just hope and trust that when national health insurance comes, that it will be a success and that people in rural and far rural areas will get the services that they are entitled to.
Absolutely. So literally we pray that the hospital is brought to them.
Closer to the people.
Yeah. Okay. Are there any other sort of challenges, like people that are, have certain beliefs or they have certain cultures, thinking, oh no, this is just, some outside influence that's doing this to my child, some magic or black magic or something else that actually holds that child back from treatment?
Yes. Again, it's a contributory cause to a child not being diagnosed. Because or the parents believe, oh, you're just being naughty, you're just seeking attention.
Okay.
Because every day the child will complain of something. I don't feel well, I feel tired. And the child won't play and not doing well at school. Oh, you're lazy, you don't want to do your homework and you don't want to attend school. What happened at school? Who's making you unhappy? Instead of trying to look at the child and notice any changes from last week to this week or yesterday till today and paying attention to it.
I know it does sound like we're dragging this out of it, but we need to focus on the causes.
It is so important.
So important to catch them while they are there. How important is it to catch diagnosis early? In childhood cancers?
Absolutely. The earlier we can get a diagnosis, the earlier the correct treatment can be instituted.
Okay.
And a child treated for cancer,
the
cure rate can be as high as 80 and 90% for some of the cancers. Whereas in adults, we're very fortunate if we reach a 50-60% cure rate. Children respond very, very well to cancer treatment, and
that's
especially if they're diagnosed early.
Okay, so that's the happy news. We want to talk after the break about the stages of cancer, and you're talking about, the children responding well to it. More on that and how the child is treated once they are diagnosed just after this. Assalamu alaikum, a very good evening. Welcome back. This is Health Matters and we're unpacking childhood cancer. It is Childhood Cancer Awareness Month, and Cancer Association of South Africa has brought that to our attention. We have Professor Michael in studio with us, as I said, literally Dictionary of Cancer. And it's so imperative, as we discuss, Professor, looking at how, that sixth sense of that mother falls in and, push and push and push. But if you have certain limits, like being in the rural areas, not having the proper medical sort of facility available to your child, adds to that 2.3. 2/3 of the children
are diagnosed.
Yeah, it's scary,
and they never reach an adequate treatment center.
Okay, so let's talk about the stages when that child. You've mentioned the lumps when you notice that. So let's talk about that tumor and that lump when it's there. What stage is that child in now?
Cancer usually has 4 stages. And stage 1 being the first stage, and it is the not that it is least important, but that is the start of cancer. If the cancer is contained in the part of the body where it originated,
where they pick up Pick it up, yeah.
that is stage 1 cancer.
And what is happening to the body during stage 1?
Then we have a local area where there is an uncontrolled multiplication and division and growth of cells.
Okay.
The moment that
And it's not a very large area that is controlled.
depending on where it is.
Okay.
I mean, if it is in a lung, it can go into a whole lobe of the lung, or even the left or the whole of the right lung eventually. But if it's in the lung, it is still
Contained.
Okay. So we will call it stage 1.
Okay.
Stage 2 means it is starting to break through the capsule of this enclosed area where it is. It's starting to work through.
Spread.
Stage 3, it is already reaching nearby tissue that isn't part of the original place where the cancer started.
Clean tissue.
And stage 4 is when it has spread to distant parts in the body.
The other parts that you don't want it necessarily. So let's talk about the danger signs of that tumor and treatment that helps at which stage.
Well, any lump should be a concern to any parent.
Okay.
Because unless the child bumped his or her head and you've got a little lump there, then you know where the lump comes from. But if there is a lump somewhere in the neck, behind the ear, in the armpit or so on, and it wasn't there yesterday, it wasn't there 2-3 days ago, and it's very often uncomfortable to the child as well, please pay attention to it.
Go and check it out.
That is a sign. Go to the doctor. It's like playing Monopoly, where we say to somebody, do not pass go, go straight to jail, do not pass go, do not collect your 200 rand. Here, please don't bypass anything. If you see these lumps, some of the more serious signs, the child is getting delirious, the child may even get a seizure or something. Any serious sign, and I include lumps as part of that. Bruises, unexplained bruises. Little red spots, we call them, the medical term is petechiae. Little areas of little red spots in areas. Those are danger signs.
Which areas of the body?
Any part of the body,
okay.
On the limbs, on the trunk.
Okay.
Those are signs where you don't bypass anything.
Okay.
Go to the doctor and make sure that you point these out to the doctor.
We want to look at the treatment. Before we do that, I just want to get a sort of a concise idea on how diagnosis do take place, because you've mentioned the symptoms is recognized. Is there a special test? Do you now then go to the specialist?
Absolutely. An absolutely essential question that you're asking. If the doctor has in the back of his or her mind, I think we are looking at something that is not just an ordinary childhood illness, which they should be alerted to by just hearing what the concerned parent is saying. Then they will start off by doing a full physical exam, which is important, which will include doing a blood pressure, doing a temperature, all these basic things that is normally done everybody, so we get a nice baseline. Then the doctor will also most probably decide to do a 1 or 2 or even more blood tests, like a full blood count, especially in very young children, because most leukemias in children are diagnosed while they're very young. And your best diagnostic instrument there will be a full blood count. So the doctor will do a whole battery of tests. He may even put a needle into one of the lumps, and we call it a needle aspiration or a needle biopsy. He may decide to give a little local anesthetic and even maybe cut out, open and make a little incision and take a little snippet of tissue. These are all biopsy tests. They are all important, makes a part of the battery. So depending on the signs and symptoms that the doctor will see in the child, he or she will decide which of these tests tests are the important ones.
Full blood tests you've mentioned now, are they conclusive to a result of cancer? Can they prove that the child...
When it is one of the leukemias,
Okay.
they'll pick it up immediately on a full blood count, and they'll do a blood smear of it, and they can see the immature cells and the number of cells, the number of white cells compared to red cells, and the different types of white blood cells, which are in the majority and that shouldn't be, so they can pick up a multitude of stories from there.
Test. Okay, let's talk about treatment. What treatments are there? Stage 1, as you've mentioned, and earlier, as you've mentioned as well, that children take very well to cancer treatments.
Children react very well. What are the basic treatments available for cancer? Again, depending on what it is. If it is a sarcoma, a soft tissue sarcoma with deformed legs, it may result in major surgery with a loss of a limb.
Sure.
So that is important. It can be as major as that.
Okay.
So surgery is definitely one of the options, depending again on what the diagnosis is. Then another very important type of treatment will be a chemotherapy.
Yeah.
And that is where the child will be given. The chemotherapy is a type of poison which we know we can give so much to a child without harming the child excessively. But we will harm and kill the cancer cells and spare the healthy cells, although a few of the healthy cells may die in the process as well. But it's very well controlled. And this is why parents should take the child to a pediatric oncologist who specializes in children treatment. But yes, chemotherapy may be there. And then chemotherapy is starting to develop in a wonderful direction lately. And we refer to this as immunotherapy. And your listeners may have heard about this. It is where they are now developing medicines. It's chemotherapy, but it's given to the person, but it does not attack the cancer or the cancer cells. It stimulates the immune system of the body to attack the cancer.
Wow, that is interesting. I want to get more into that.
Fascinating stuff.
Absolutely.
But unfortunately not available to everybody.
Okay. So
immunotherapy can cost as much as R1 million per patient per year.
Okay.
But it is becoming available, and we must remember that.
So we're going to get more into that and other treatments just after the short break as we highlight Childhood Cancer Awareness Month here on Health Matters. Back in a moment. Assalamu alaikum and welcome back. This is Health Matters, and as we wrap up our Childhood Cancer Awareness Month and looking at more of the medical side of it, we're joined now by Dr. Shuaib Wadi. Shukran so much, Doc, for being here and rushing through, making time available for this very important topic. We've actually unpacked quite a bit, and I'm baffled by this idea that there's so many children that go undiagnosed. But we also have Professor Michael, who was just informing us about another therapy that is available, immunotherapy, and breaking down some of the pros and cons, and how it's available to some and not to others. So just to recap again, Professor?
Yes, we've now mentioned surgery depending on what the diagnosis is. There could be surgery like a loss of a limb in some of the soft tissue sarcomas and things like that. Then we mentioned chemotherapy, which is the giving of medicine. It can be given by mouth, it can be given intravenously, it can be given by injection directly into a tumor, but that's the chemical side of it. And then the immunotherapy is also part of the chemical side, but it's the latest development in chemotherapy, and it stimulates the immune system of the body to attack the cancer. The side effects are far less than we normally see with chemotherapy, with the nausea and the vomiting and hair loss with some of the certain chemotherapeutic agents.
Okay.
So we don't see this with immunotherapy, but it is so expensive.
Yes.
And I was saying just now that it can cost up to R1 million per patient per year in South Africa, because we've got to import these things specially.
Assalamu alaikum, Dr. Wadi. You didn't give an initial greeting there. So yeah.
So I'm the late substitution today, you know, and
just for the medical bit.
Yes. So I mean, look, the thing about cancer and the treatment of cancer, as Prof has mentioned, when you can remove the whole thing surgically, you can get the cancer out, and then the cancer is cut out, literally that part which is cancerous and abnormal. Yeah. But remember, cancer grows from your own body, from your own cells. So lots of the parts of the cancer are very similar to the rest of the cells around that. So sometimes they can't tell where the cancer ends and the cell and the body starts. Okay. Also, that cancer can spread to other parts of the body and be hidden and invisible. So that's why even sometimes when they manage to remove it surgically, they need to use chemotherapy or other forms of therapy. And at the same time, there's some cancers like cancer of the bloodstream, leukemias, lymphomas, and so forth, which are very difficult to remove surgically. You actually need to target them with chemotherapy. And the problem is that because the cancer cells are similar to your own body cells, if you target the cancer cells, there's collateral damage. They're living amongst your other cells, so you damage parts of your own body. So that's where the side effects come up. So where the advances in chemotherapy are in getting molecules which are much more specific for signals and cell and abnormalities which occur within those cells. So what happens in cells as they become cancerous, they change the genetic profile, the type of proteins that they produce inside for their cell mechanics, which is why they are cancerous cells. Yes. Those proteins differ slightly. So then more targeted and sort of boutique molecules are developed to try and target those specific molecules. So now you have small molecules which target just one enzyme in one specific way and will only work for one cancer, for example. So those are the type of therapies. But obviously, because they will only work for one cancer, the number of people that will benefit are small. And so for the drug company to recoup their costs in terms of development, they charge a lot. Yeah. So those chemotherapies are very expensive.
And we import them in euros and in dollars. And that makes them so expensive.
Yes, and then look, obviously where the immunotherapy comes in, so the immunotherapy are therapies which, as Prof says, will stimulate your immune system. So in fact, the first line of defense against cancer is your immune system. So if your immune system is working very well, you find that you may be able to prevent cancers, even small cancers that are developing even right now as we're sitting here. Some cells becoming abnormal and looking to become cancer. The sheriff of the immune system says head them off at the pass, knocks them out, they don't develop into cancer. And that's the first line of defense. And in fact, you find in people whose immunity is suppressed, their risk of cancer increases substantially. So the corollary to that is if you can stimulate the immune system to recognize those differences in the cancer cells, you may then be able to target those immune cells to attack only those cancer cells, and there's various mechanisms of doing that.
So Professor Michael mentioned earlier on as well how the children are not prone to drinking and smoking and having all those bad things happen to them, is why other people, adults have cancer.
So lifestyle is not
that
a major cause of children's cancers.
But environmental factors are. Could we make mention of some of that environmental factors that are affecting his child?
Environmental factors are less of an effect than in adults. A lot of it is genetic. But things like exposure to radiation, among some others, exposure to certain medications during the gestation, and obviously in their childhood, that may be put them at radiation is probably the biggest one for childhood cancers. Okay,
and the other environmental factors you were referring to, Prof?
Well, radiation, doctors mentioned, and we very often forget, that the sun with radiation, and that's one of the major causes of changes in the skin, and we can get different types of skin cancer from it. And interestingly enough, is people with a dark complexion, if they get melanoma, they very often, it's manifested not in the parts of the body that's exposed to the sun, but they'll get it under the soles of the feet, in the palms of the hand, other parts of the body where the sun doesn't normally get. And this is what Bob Marley died of. He died of melanoma under his toenail.
And the problem is that because it's so innocuous when it starts and not obviously noticeable,
It's easily neglected.
that by the time it becomes a problem, it is spread to the lungs, the brain, and elsewhere, especially that particular type of melanoma. So I think being aware of the risk of cancer and looking out for it, as Prof will tell you, prevention is the number one way to keep yourself
And I think
going.
An observant mother.
Yes.
There we go. We said that earlier. Talking about the mother and the family, and I think what I wanted to mention on that point was that often you hear these sad stories that is usually the case. You know, it comes to the last. They didn't know. It's just sprung on them final stage, and you know they've missed the signs. But for a child, and all those technical terms, medical terms that they have to learn, they want to understand, they want to know what's going on. They become a little bit more intelligent than other children at their age, but they're also in a different environment, and they don't normally do what other children does. So does it affect the child when they, and how much does it affect their child as a child, being a child,
each child
when
is
you have
unique
a
and
cancer?
different.
Yeah.
Some of the children can be badly affected by their disease, especially if they have reached the age where they know that there is a possibility that I may die, not being cured, that I may die. If they haven't reached that stage yet, they're oblivious and they do well. Depending on what stage the child is. And I think only give the child information that they ask for.
Okay.
Don't overwhelm them and provide a whole lot of technical information and things. Oh, you know, this may happen and that can result and so on. If the child asks a question, only answer the question.
Dr. Wadi, for
I
you,
think the difference between children and adults is that in the child, the decisions are not being made by the child.
Yes.
So the information that the child needs in terms of making decisions are obviously going to vary. As the child gets older, they want to be involved in the decision-making process. They want to know what treatments you have in store for them, and they want to be able to contribute to the decision. But when they're much younger, they don't want to and they're unable to contribute to that decision-making process, and it may only be traumatic for them to you know be too technical and.
But as a family, you know, in a family sort of area, you know, thinking that this is a child, you don't want the child to feel too much isolated. What sort of conversations can you have with that child still to show love and care? And I'm sure there's lots of pain. There's lots of pain happening as well.
But I think one must be careful also not to over-pamper the child.
Okay.
And remember, if a child is diagnosed with cancer, everybody in the family is affected.
Yes.
Right
So
from granny, uncles, aunts, brothers, sisters, even the pet dog may be affected.
And it's really a tragic life-changing event across that spectrum.
And we still see it as a death sentence.
It's not a common event. It's not like 10% of children have cancer. It's a very small percentage of children that have cancer. And most kids who have serious life-threatening cancer may not meet another kid who's had serious life-threatening cancer except in a hospital.
Yes.
You understand, in that setting. So they do want to have kids that, especially as they get older, that they can relate to, that are going through a similar experience, but they also want to feel normal. Yes. And this is not just with cancer. In fact, this is with almost any chronic condition that young children have. They're not in a phase of their life where you expect them to be sick. You expect them to be children growing up, you know.
So as we wrap up, Professor Michael, what is your take-home message today?
My take-home message is know your child. And I'm talking especially to the mothers, because they are, even with the changes in our demographics in South Africa, mothers are still the ones who spend most time with their children. Yeah. If something is different today than it was last week, and it persists, have it seen to.
Earlier on, Dr. Wadi, we really unpacked the idea of not being diagnosed, and actually some children never actually being diagnosed, and the lack of medical, health structure, access and all of that to the child. So I think, from your side, I think medically and also that message to the mother and the family and the community, in fact, as a whole, whatever religion or creed you're coming from, what do we need to learn and understand about a sick child, and not just the mother playing a role, the father father, but the rest of the healthcare services?
So I think from the healthcare services part, one of the things, look, our health services in South Africa are overburdened. There, especially if you are indigent living in a poor area, in a rural community particularly, you may not even have access to a medical doctor every day of the week, for example. I think one of the things which doctors and health professionals do wrong, and Prof has elucidated that, is they don't listen to the mother. And the mother is often the child's first doctor. 80% of the ailments the kid has got is not coming to a general practitioner, it's not coming to, and the mum is doing something at home. So that's a role the mum is going to have to play. Not everything a child has needs to go to the doctor. So often by the time the child comes to the clinic, comes to the doctor, the mother's tried something, she's figured something really bad is wrong. It's not something that she's expected. Sometimes the mum is wrong, it's possible, especially first mothers, first time, and so forth and so on. But especially mums who've had many kids, or who have the kid is a bit older, often something is wrong. It may not necessarily be cancer, there could be other chronic conditions, like the child's not growing, he's not eating like he was eating, he's not playing like he was playing, something has changed, something is different, you need to take due care. And in a system where we're overburdened, it's very easy to shrug off that desire of the mother for care and say, come back later, I'm sure it's nothing. But sometimes it's not nothing.
That's why we have mothers.
That's why.
Absolutely. And when they're not, let's be a mother to a child. Professor Michael, just quickly before we leave, give us some contact details of hospice and people that just need that assistance.
Toll-free line.
Cancer.
Let me give that first of all. The toll-free line, 0800 226622. They can also go to the website, www.cancer.org.za. And they can also send in their questions if they've got access to the internet, info@cancer.org.za. And those questions very often come to me, and I respond on the same day. Really, people, if you phone me as well, I will give you the answer immediately, because I know that I don't want myself to have to wait for a response. So I do my best to respond on the same day.
Thank you so much, Professor Michael. We'll remember that name at Cancer. Dr. Wadi as well for your time this evening and looking at the medical side and the IMA, also helping us put this all together. We appreciate you guys' time and all the best. Enjoy the rest of your evening. Assalamu alaikum to you. There we have it, childhood cancer. It's Awareness Month for September. Please do contact Cancer. They have a toll-free line, 0800 22 6622. We put that up also on our Facebook page. And remember, you can visit their website, cancer.org.za. Remember that name, Professor Michael, who was here with us today, and he'll help and assist with whatever questions you have. There is also an email, and you can check out their website for more information. From myself, Hoa Solomon, have a good evening. Remember, childhood cancer awareness is often missed, but you as a mother can find it and push your way through it. Wassalamu alaikum and goodbye for now.